You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome to the show, Health Innovators. On today's episode, I have a very special guest, Tom Lawry, who is a globally sought out keynote speaker at many of the health innovation conferences that we are familiar with and many others, as well as the author of Hacking Healthcare. And I want to read this subtitle right: How AI and the Intelligence Revolution Will Reboot an Ailing System. Welcome to the show, Tom.
Thanks, Roxy. It's great to be with you today.
Thank you. So can you just start off by telling our audience a little bit about your background and what AI means to you? How did you even get here?
Sure. Well, I guess to begin with, I kiddingly refer to myself as a recovering Microsoft executive, where I left Microsoft after about 14 years to go full-time with something called Second Century Tech. But my background is rather simple. My last role at Microsoft was serving as the National Director for Artificial Intelligence for Health and Life Sciences. Prior to that, I was Director of Worldwide Health, which essentially meant instead of working most of the time in the United States, as my last role was, I was mainly working outside the United States, but also doing data analytics and AI. Anyway, 14 years at Microsoft, a former GE health exec, 7 years in the venture-backed startup world with two startups. I did both were hosted software for healthcare. Prior to that, I actually started life as a hospital executive here in America. And prior to that, I think I had a paper route.
So you've already lived 12 lives.
Well, I don't know about 12, but I've been very fortunate in being able to do a lot of things that I remain excited about.
So how long have you been involved in AI?
Well, it's hard to say in that, AI is the popular topic everyone loves to talk about. It's having this major push and advance, as everyone knows now. But really, AI is part of a continuum around analytics. And so in some way, shape, or form, I've been involved in analytics pretty much all of my career. Back just even a decade ago, everyone was talking about this new thing called business intelligence. And a lot of it was just the growing recognition of data as a strategic asset, data as the ability to use it in ways to, particularly in healthcare, be better at improving the quality of care and outcomes or the effectiveness. So, when you look at analytics and data as a continuum, and still there are so many things outside of AI that are still exceptionally useful when it comes to being able to improve performance with the use of data. So, I've been at it a long time.
Sure. Yep. So let's just kind of level set with our audience. How do we define AI and the intelligence revolution, and maybe even some context of how is that different when we talk about the intelligent health revolution?
Yeah, well, basically, all great questions. There were like 5 questions in that one. But so to start with, if we assume a very basic definition on AI, which is, IT functions or computers that have the ability to mimic human brain functions. And I always like to emphasize mimic. I think that's a pretty good definition. And so there are a lot of things that we as humans have created. We always need to pull back, given some of the conversations everyone's having right now with GPT and large language models, pull back to say, all of this is just an output of the human brain and our own creations. So we've gotten to the point where, as I often talk about in some of my workshops, the brain is such an incredible thing that it's actually started figuring out how to outsource certain things that have heretofore been unique to humans. So AI is really good at things like pattern recognition, computational values, sorting through massive amounts of data that the human brain is not capable of. And then at the same time, humans and the human brain is better at many other things like reasoning and common sense and gaining wisdom. And it's that combination of things that really drives creating value when AI is brought in and behind humans, such as doctors, nurses, anyone who's a knowledge worker. As far as the intelligent health revolution, which I actually coined in my first book a couple of years ago, what I would simply say is today, pretty much every health and medical organization is making some use of artificial intelligence. The key is, and I like to break it down, is I think we're seeing the emergence of two types of health systems driven by AI. The first is what I would call traditional health systems, which are healthcare organizations that can be provider organizations, payer orgs, anything. But essentially, they're using AI to take their current business model and just make it more efficient.
Yep.
An intelligent health system, which is part of the revolution, can be anything. It can be a big provider organization. It can be NHS. It can be a division within NHS or a division within any big healthcare organization. But the fundamental difference is they're using AI to rethink everything, to rethink all experiences, all touch points that they have with patients, with consumers, with their own staff. And in doing this, AI is really opening the door to be reinventing a lot of the business processes. Now, the fundamental mission may still be to improve health and well-being, but the way in which they're going about it, AI is allowing them to fundamentally rethink and change all of those processes that may have been in place for decades.
And we need that.
I think the answer to that is yes, or absolutely yes.
Yeah, right, exactly. So what do we think we know about AI and how it can transform healthcare that maybe we really have all wrong? Like, what are some of the myths or misperceptions about AI and what we're going to be able to do with it?
Well, maybe let me kind of lead into answering that. So a couple of things. I mean, right now, and time permitting, I assume we can have time to talk about the latest that everyone's talking about, which is large language models and GPT and a lot of the hype and histrionics going on right now. But I guess to your point, I would back up and just pose a few things for people to think about. One, we look at what we learned from the pandemic, and I wrote an article for Forbes where they asked me to say, what did healthcare learn from fighting a global pandemic? And the themes of the article were, we showed that an industry that's known for moving at glacial speed can in fact move at warp speed when motivated. We learned that many, not all, but many leaders in health and medicine are willing to challenge the status quo and are able to drive agile transformation. Third, we learned that while humans fought and won the battle, AI was the tool they chose or weapon to make it go faster. So we think about that, but then I also always like to pose the question of telemedicine has been around for at least 30 years. All of the research and studies going back 3 decades show it's very efficacious. Why did it take a pandemic for us to pull it forward? So I look at that. I look at the value of technology in the hands of caregivers, clinicians, to make them better. We learned it with telemedicine. A lot of that's being driven now by AI. And it's the same value prop that I put forward to say, let's take what we learned with the use of AI and let's apply it to be solving all these other big problems like chronic disease, like the opioid crisis, like all of these things that everyone talks about attacking. And yet we've shown that the old ways of thinking and working are not getting us very far. So there are things like that. There are things like, particularly here in America, and I just came from speaking and working in Sweden earlier this week. And here in America, we often hear providers and others talking about, we provide personalized care. And whenever I hear that in the back of my mind, I think, no, we don't really. We provide good care. We provide high quality care, but we don't really personalize it. So back to your question and maybe wrapping up on this side, so my answers aren't overly long. It's interesting to me, we talk about personalized care, and yet AI gives us the ability to really make that happen, even if we just start by going at personalizing at the generational level. And I often talk about this, and I write about how the needs of a boomer are dramatically different than the needs and the preferences of a Gen Xer, a millennial, a digital native. And so why is it that we treat them all the same? Where a boomer, the data shows they love the primary care people and that process. A PCP for a boomer is almost a human version of an app. Meanwhile, a millennial, a Gen Zer, the research shows the last thing they want to do is have a gatekeeper called a PCP. They want to do the medical consult from the same place they ordered dinner, which is their couch. So we have the ability to do all those things to bring an AI in behind it. We're seeing some good organizations that typically aren't the traditional health systems making better use of that. So that brings me back to that intelligent health revolution, that there are some organizations that will use AI to just get better at what they do, and others are looking at how to totally redefine that experience.
So what do you think is different about AI? Because, in my mind, and I'm sure we can all agree that historically, healthcare as a vertical is a laggard when it comes to change, when it comes to the adoption in general of innovations and new ideas. And it seems as though, at least the perception is, that we as a healthcare ecosystem, whether it's in the US or around the world, seem to be embracing AI in this potential revolution and how it could change our businesses or change care for society in a different way than we have maybe other things, right? We're not taking 30 years to adopt AI like we did with telehealth.
Let us hope not. So again, I think the pandemic helped really accelerate the use of artificial intelligence in health and medicine.
Yeah.
I think like telehealth and telemedicine, as the pandemic subsided, there were those started raising the question of, can we just go back to the old ways we did things and not really do as much on things like telemedicine or in some cases AI?
Yeah.
I think we cannot control progress. We cannot control the pace of change. And I think it's up to healthcare leaders to decide how they are going to respond and hopefully leverage these new tools against being better at their mission, their business, and clinical goals. A big thing I'm talking about today, I'm advising with my clients, is as we think about AI and what's happened just in the last 6 to 9 months with things like large language models, it's less to me about what AI is capable of doing. And the thing that I think is really kind of freaking people out, including leaders, is the velocity of change it's driving. And so to your point, if you look at what economists and anthropologists often talk about, the whole world, including leadership, is geared towards steady state linear growth in the world. So something comes along like a new technology, it provides incremental value. There's a small gap between when it's introduced and when everyone starts adopting it. As that happens, there's another small gap between the adoption rate of most people in mass and the policymakers who eventually catch up with the appropriate guardrails. That's the way everything is geared to work. That's especially the way healthcare in America is geared to work. And all of a sudden, we have something else coming along that economists call the exponential growth curve. Mathematicians have a formula for it to say, what looks like linear change starts out looking like that. And then all of a sudden, it creates this hockey stick of exponential growth. We're seeing that right now with AI. We're seeing that with things like ChatGPT and the space race for large language models among all of the big tech titans. And as that happens, it's producing an incredible amount of change that no one seems to be able to keep up with. And that's kind of the challenge of exponential growth curves. It creates what some are starting to call chaotic innovation. So we don't have the luxury of that steady state right now. Instead, we all have to be looking at what's coming at us, the rate of change. And then it's fundamental to say, you're either going to resist or you're going to start leaning in to say, look, we don't know where this is going, but we're going to lean in to start looking at what's possible and how we might leverage that to make our services, our delivery, our ability to support our workforce better.
Yeah, I think that there's still people out there that potentially think that AI is a fad, like they thought the internet was a fad or social media was a fad. And so, there'll be those folks that completely transform their businesses and usurp a lot of incumbents and steal major market share like we see in history. And then there'll be those people like Kodak, like Blockbuster, that are ignoring it and denying it, and end up what I call in the zombie graveyard.
Yeah, I think that gets back to this model that I see, which is there are I think two types of health organizations emerging. There are the traditional orgs that we've seen and known. They're still going to use AI, but they are going to do it at a different pace for different reasons than those who are saying this gives me the ability to either create something new or reinvent the way we do things that are better able to serve, again, consumers, patients, and an extremely important population groups like physicians and nurses who we are chewing up right now because we've got old and inefficient processes we're forcing them through. Yeah. I mean, to your point, it's interesting to me, you mentioned Kodak, and one of the chapters in my book starts with the story about, most people don't know, but the original digital camera was actually invented inside of Kodak by a group of developers. So, here's new technology that's set to change the world. They take it to leadership and say, we have the ability to have a filmless camera. And what did leadership do? They buried it. And burying a good idea, they buried the company. Yep. So I look at what's happening, and to be a little flip, it's kind of like all of these old B-grade sci-fi movies always have this line in there that says, resistance is futile. Change is going to happen. The technology progress we're seeing will continue. And I'm sure you and those tuned into this have seen, recently there was a global petition that's going around signed by people like Elon Musk saying, hey, we have this petition. We want to suspend progress or development on this for 6 months. And when I look at something like that, my next idea is to say, I want to start a global petition to say next month I want to suspend gravity.
Right.
I think that the issue is not slowing down progress. I think the issue for all of us, especially in healthcare, is how we expedite things like education of leaders, education of policymakers, to fast forward to say, let's look at this as a tremendous opportunity. I was asked a question. I did the opening keynote to a great conference in Sweden called Vitalis this week. And after my presentation, I was asked the question about, maybe we should be suspending this because everyone's freaked out by it. And, one of the things as everyone talks about that is whether it's somehow slowing it down, which I don't believe you can, or whether it's, health leaders slow walking its use and adoption. I mean, the flip side of this, everyone worries about the nefarious things that it may be used for, but I turn it around and say, well, if we go slow, what if there's something that things like large language models will help us discover that are dramatic breakthroughs for health improvement, for disease prevention, but somehow because we're slow walking it, we either don't find it, or it takes us, 2 years to find it, 3 years to find it. In the meantime, all of those people we could have been serving
or saving
that are not the beneficiary. Absolutely. This is where I think the broader conversation should involve, again, you're either going to resist or you're going to lean in. Those who are leaning in, it's like, this should be a broad conversation among clinicians, among bioethicists, among policymakers, among social science experts to say, once we understand what this is capable of, what are all the ways we can use it to improve the things we care about? And then how do we place appropriate guardrails on it so that it's not going to cause harm, and it's also going to benefit everyone, not just some?
Absolutely.
Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit.
So we've got thousands of health innovators out there, maybe even, tens of thousands out there around the world that get it, right? They don't need to be persuaded. They're building use cases and solutions to be able to be more proactive, to be able to have more personalization and predict weave in prediction into our healthcare. So they get it. What do you have any guidance or suggestions for those folks that are trying to bring those AI-based innovations into the healthcare ecosystem and trying to facing and trying to overcome some of the barriers that you just talked about?
Yeah, well, I teach whole half day and full day workshops on that, and we're probably not going to have a half day to cover this. So
yeah.
I guess I say quickly, for anyone, again, tuned in, the question is always, how do you use AI and turn it into a superpower instead of being afraid of it? And I think there are just a couple of things that if you keep in mind, you will do well at. One, you don't need to understand how AI works. What you need to understand is what it's capable of doing. Whatever role you're in, if you're in healthcare, you're a clinician, you're a rev cycle specialist, you're someone who's a knowledge worker. You are the smartest person to look at whatever expertise you have and the problems you're trying to solve within an organization. If you understand the capabilities of AI, now you can start looking at how do I use those as building blocks to apply it towards solving this problem you're an expert at. And this is where I see many people who are very talented, who are very accomplished, who are very smart, that somehow when you start talking about AI, they freeze up, they push back, say, I don't know anything about how it works. And my answer is always, how many of you, I'd be willing to bet that everyone tuned in have their cell phone in their purse, their pocket, on their desk right now. They're called smartphones because most of those apps you use are driven by AI. Every time you pull up DoorDash or Uber, do you think about what's going on in the background, or do you just use it?
Right.
So it's like, understand what you can do, not how it works. The second is, we touched on this earlier, understand what AI is good at and what it's not. So there are many times where, and the hype in histrionics right now is in full bore about how everyone's going to lose their job. And if you understand the value prop of what AI is good at, what humans are good at and will remain good at, the real conversation is, everyone who's a knowledge worker, I can guarantee, you will likely have a job. That job may be very different in how you do it, but it's not about losing jobs. It's about getting behind how it will change the way you do work.
Yep.
Start leaning into that. Be one of those fast first, and I can almost guarantee you'll have more recruiters calling you than you should be worried about whether you're going to have a job. And third and finally is simply, and I always have to push on this, and we're already seeing it, unfortunately, where already with AI, we're seeing some of the biases and inequities of the real world crossing over to the digital world through things like algorithms. And so it's incumbent upon all of us who are using AI to really work on the issue of, is AI going to be benefiting all people or some? And there are lots of things we can talk about, but having reducing bias and inequity starts with just generally awareness of everyone who's in the health system who may be in some ways using some form of AI.
Yeah, I actually spoke at a conference a few weeks ago with some colleagues, and we were talking about personalized care models, and is technology really enabling that or not? And some of the things that we talked about was some of the data that's missing, that's not represented in these large data sets. And so if we leverage AI, who's being left out, exactly what you're talking about. We talked about female representation, minority representation, even things like questions that we need to ask, so that way those large data sets can start calculating that data of, health literacy and social determinants and locus of control and all of that stuff. So there's a lot of work to be done. Let's talk about the large language modeling and what's happening right now with ChatGPT and this kind of firestorm that's happening. What's different about what's happened in the last 60, 90 days that's caused such a ruckus compared to, let's say the last 10, 15 years that you've been working in AI?
Yeah, well, had we been taping this a year ago and I had said ChatGPT, how many people would have any understanding or large language models, what we were talking about?
None.
Today, you know about it. Your kids know about it because they not only know about it, they're using it to change the way they learn and do their homework. I was coming out of the HIMSS conference 2 months ago, and I stopped in Cincinnati to visit with a friend's 100-year-old mother. We're sitting in a dining room of a nursing home, and all of a sudden, here's a 100-year-old asking me about ChatGPT. So it tells you a lot about the pervasive nature of what's happened just in the last 6 to 9 months. So whenever people talk about GPT, I always want to stop and say, okay, here's the educational moment. GPT is a flavor of large language models. This one was developed by OpenAI. Groups like Microsoft have licensed it. Other big companies have their own flavors of large language models. We're already starting to see smaller organizations coming up with specialized large language models. So when you hear GPT, I want everyone thinking, okay, that's one of many flavors of large language models. Large language models is basically a very comprehensive, deep set of things around what normally would be considered natural language processing, where just as we spent a whole lot of time mapping the genome, we have now spent a whole lot of time mapping all aspects of words, language, syntax, interrelationships across, everything that's ever been written. It's based on that and the use of what's known as neural networks that allows large language models to be extremely deep and precise at doing many things, such as, writing everything from prose to computer software language. It has the ability to go in and do many things when it comes to looking at large language and data sets and doing things like summaries. So if it can summarize an entire encyclopedia, it can also summarize with great effectiveness things like someone's health record or a population of people such as diabetics, to start condensing information. Beyond that, there are many things, and I'll stop because we've got plenty of other things, I guess. But this has been screaming on to the forefront just since last fall. So when you look at what it takes to get 100 million users to adopt things, I think the fastest heretofore was TikTok, which took 9 months. ChatGPT reached 100 million users in 2 months. And shortly after it hit that milestone, GPT-4 came out in mid-March, which makes GPT-3, which is the basis of ChatGPT, look very pedestrian. And we don't know when version 5 is coming out. So moving very quickly, it is the new space race, not just in AI, but for all of the big companies that do technology. I mean, the last decade, the space race was the intelligent cloud. The intelligent cloud kind of sets up the basis, like a Maslow triangle, to start driving these large language models to be very pervasive in everyone's lives and in everyone's systems.
So where do we go from here? What are some of the, if you're an innovator or a healthcare leader, what are some of the next steps Do we need to take your workshop, be educated to be able to make better strategic decisions across our organizations? What do we need to do going forward to make sure that we are not being blindsided and not ending up like Kodak, and making sure that we're open to this chaotic creativity and innovation that is upon us?
Well, again, I would say it starts with leaders making a choice of either, as you said earlier, and I've heard leaders say this. I was asked the question by the leader of an organization everyone would recognize a month ago, where basically they said, I need to know, is this a serious movement or is it going to pass? And my view is large language models is a very serious, potentially life-changing event. And yes, everyone needs to be looking at, again, you don't have to understand how it works. It's good to understand what it can do, because then you can start looking as your career, as a product developer, as an innovator, what you're going to do to leverage the benefit of large language models, to be better at something you care about, be better at something that your customers are going to care about. And it's just a matter of awareness. It's a matter of then following the path. I keep seeing these things where, again, I think a lot of the coverage in the press is a lot of misinformation, it's a lot of hype. We need to be increasingly looking at, what's the evidence of what can be done? And as we do that, then again, the experts at whatever you are in the best position to say, now that I have evidence for what this can do, here's how I'm going to take what it can do and somehow leverage it to solve a problem. And so we're already seeing, a lot of the early things around, the marketing agencies and others who are fast first are already reinventing it. Instead of worrying about, whose job's going to be lost, they're looking at, how do we automate and make things better for what we do? We're seeing the early evidence and work on similar things when it comes to health and medicine. The difference is when someone like Microsoft's put ChatGPT into a search engine and it starts hallucinating, and, with a New York Times reporter, suggesting they're in love. It's one thing if that's a search engine. It's another if things like that start happening as we put it to use in clinical decision making. But this is where, the best people to look at that, to be working with it, to be testing it, are in fact the very specialists, the clinicians who are the experts today. So there's a process, but it's just back to what I said. I understand what it can do. Know that's a changing game almost daily. So one other quick thing that most people don't know about large language models: most of the functionality we're hearing about were not programmed or directed by humans. So for example, when GPT went from version 2 to version 3, almost by accident, we as humans discovered that it could translate from one language to another. It wasn't that there was a group of data scientists that said, hey, as we move to the next version, let's see if it can do translational intelligence. It just happened. That's the process with large language models. The more data it's learning on, the new and different things that may be coming forward. So when I'm often asked the question, as I have been in several media interviews, about where is large language models or GPT going in the next year as far as capabilities, given what I just told you, my answer is no one really knows. But our ability to say, which if you're a curious person, I'm fascinated by saying, well, I wonder what's next. Standing there, understanding it, to then start having those dialogues of whatever that capability is that something that we can bring in behind the knowledge workers to be augmenting your work to make you better at something you care about. There's that, where there's the, hey, we're gonna slow walk this, or we're gonna hope it passes, and it won't. And those who take that route, I don't think will fare as well as those who are leaning in. And leaning in doesn't mean you got to be comfortable. I mean, think about any learning experience. If you're really pushing a learning curve on yourself, you're going to make yourself uncomfortable. And it's almost like, given the massive velocity of change, I think we all need to kind of be okay with being a little uncomfortable right now.
I mean, it is massive change management across the board in every facet of healthcare, no doubt. One of the things that I say often is, we don't need more technology. We need adoption of the existing technology that we have in place. So we definitely have some major adoption issues that are just happening across the board. It'll be interesting to see whether we still have some of those adoption barriers like we do with other things, or whether this is actually this wake-up call where we start to see a lot more of that adoption and scalability across entire ecosystems and organizations to really be able to benefit from that real change, instead of we bought something, we implemented it, but damn, nobody's using it.
Well, I think this is where, to your point, I think, I pull back and, fundamentally, I think health and medicine is a very noble cause. Particularly here in America, we've got some huge challenges that I believe will not be solved by the old ways, traditional ways we've done things. This gives us a great opportunity to truly better serve the people that healthcare should be serving. Yeah. It's also, beyond serving the mission, it is going to create competitive advantage. That there will be winners and there'll be losers. And, so it's that combination, and not everyone is going to be a winner. And I'm already seeing things like, in my view, and I mean, no disrespect to any of the subsegments, but as I look at what's happening, and, the data is starting to support it, where some of the non-traditional providers, particularly some of the big retail health organizations, even before large language models came screaming onto the scene, they were already ahead when it comes to the adoption curve of AI, to be looking at how to change things like the patient experience, all of those touch points compared to the traditional provider organizations. One study I saw from the American Hospital Association said by the end of this year, up to a third of all primary care visits will be done by non-traditional providers, which anyone who understands things like referral patterns and things like, again, gatekeepers of PCPs to specialists, that's a fascinating factoid. So you add that with then the increased use of tools that then better serve millennials, digital natives. And to me, you're starting to see the setup for a market shift that could be very dramatic and very fast compared to the way the markets have operated for the past couple decades.
Absolutely. I was blown away when I read that Walmart was going to actually be the largest primary care provider in the next couple of years, with over 4,000 clinics. What?
Well, but when you look at it, Frost and Sullivan is a group that did some really outstanding work in looking at retail health and then some of the changes that came about because of the pandemic. And when you look at how the pandemic set everyone up to be exposed to the opportunities of retail health. It was a brilliant move on the part of the big retail health people to do what they did during the pandemic. They literally were that single source of everything from, being able to go to one place to buy supplies, provisions, get your immunization shots, go to the clinics. I mean, it was a dramatic move that really had everyone exposed to the value prop and what they can provide. So they're building on that. They're much faster and moving in general on looking at use of intelligence. And to me, they're a good example of what I believe are those moving towards being intelligent health systems rather than traditional systems that make use of AI.
Completely. The example that comes to mind is Amazon, right? Who really already mastered AI when we think about just Prime Video or just their platform, right? Being able to predict what we want to buy next and serve it right up to us. And then how the advantage that those types of brands have to be able to just translate that into healthcare and be way ahead of a lot of these traditional healthcare entities. Completely agree. Yeah. So Tom, there's another 8 hours worth of conversation that I would love to have with you, but we don't have that time today. And I know you're jet lagged. So let's, I think about, we touched on some of these with, data and security and ethics and people and job loss. And there's just so many different facets. So I'm going to allow you to make a choice as we kind of start to wrap up here. What are 2 or 3 key points that you want to make sure that we're getting out to our audience, that are really, folks that listen to our show are the ones that are driving innovation? What is it that you want to share with them around any of those other topics?
Boy, that's a lot.
I know.
No, I would simply say, I'm trying to parse everything, having a little jet lag. So, the main thing I would say, and the main thing that I see and do in my work is, don't be afraid of this. Whatever you do, whatever your expertise is, you've got this. You can master it. And I'm sure many of you don't remember, but I left a perfectly good career running hospitals to start my first tech company, and I wasn't a tech person when .com hit. When .com hit, that's the only other example I have in my life of how dynamics were similar. And I remember doing things like offering classes to teach physicians how to use a browser, which was a totally new thing. And I know it sounds silly, but there are many of you who are digital natives that go, what?
Right.
It's just to say, what you're seeing, it's not a sprint, and everyone in the media seem to treat it like a sprint. This is a distance race. We're early in the run, but it's just, you've got this. It's all about not being afraid of it. It's all about leaning in. Leaning in to me means, again, you don't have to teach yourself how to program something. You have to understand just, okay, it can now do this. It can do things like, I've seen evidence that it can do a great job of automating things like providing clinical summaries. So instead of a physician dictating something, it literally, with some ambient listening devices, can do that for you. It can, it's starting to approach things like empathy.
The HR system.
So it's just understanding what it can do, where it's going, and then looking at, well, how does that apply to either what I'm doing now, or understanding what you're doing now and your expertise to say, armed with what you do, armed with the new capabilities, maybe there's a way of actually reinventing what you do, reinventing your job, reinventing your career. But there'll be those who do that. There'll be those who want to crawl under the desk and hope it goes away. And I know which ones I'm going to bet on. And I'm hoping you're the ones leaning in. So I would say that, plus all those other things. Buy my latest book. No, I'm kidding. Well, I'm kind of kidding, but no, it's the last book, Hacking Healthcare, which is interesting because it came out in July, and then this whole craze hit in September. But it's really the premise of the book is kind of it's following what's happening, what's gone into hyperspeed since last fall.
Yeah.
But it looks at what are all the dynamics for how AI will impact health and medicine, and then how do we actually leverage it, channel it to solve all these problems that everyone's talking about, but no one's solving right now. So, I think technology is neither good nor bad. Everyone's talking about, all the potential problems and issues. It's neither good nor bad. It's kind of like, Darth Vader in Star Wars. It can be good or it can be bad. We get to pick which direction it goes in. And hopefully everyone's going to be leaning in and doing very well with it over whatever period of time you're still going to be working.
And I think of it like the internet, right? Exact is a perfect example of what you just described. We are not going, those that are, get it and trying to change the world with AI, we are not going to be able to stop and prevent all nefarious use cases of AI. But that doesn't mean that we shouldn't embrace the good that can come, just like we can't control what people do with the internet that is, bad and destroying lives, but the internet also still provides a lot of conveniences for a lot of people around the world, for all of us.
Technology is a vehicle.
Yeah.
What we as humans choose to do with it is totally up to us. And this is where I believe the future of healthcare is very much driven by this. And again, it's not supplanting. It's like there's still articles being written around, hey, with AI, maybe we should stop training as many radiologists. And every time I see a goofy story like that, it tells me they don't understand what AI is good at. And they probably don't understand what radiologists actually do. So it's like, when you're seeing these kind of stories, you got a choice to make of, okay, no, I'm going to choose to either buy that stuff and crawl under my desk, or I'm going to start looking at how I'm going to leverage it and actually have it be a force. I truly believe, do it right, it becomes your superpower compared to everyone else crawling under their desk right now.
Absolutely. Complete competitive advantage. I think for all the healthcare leaders out there, they absolutely must read, whether you are embracing it and building technology innovation already on AI. There's so much that you packed into this one book. And I agree with you. I think it's incredible timing on your part to have this already in the hands and made available to so many of us that really can benefit from what you have. So thank you so much for joining me today.
My pleasure. Thanks for having me on. And hopefully we gave people some things to think about.
Absolutely.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.